Good morning. There are a lot of questions regarding my experience of IVF and when I started this IVF and what was my journey. So I want to make a small video about my journey. And I'm a gynecologist basically, MS in obstetrics and gynecology, masters in obstetrics and gynecology from Jabalpur Medical College. And I have a special interest in reproductive medicine and fetal medicine. Reproductive medicine means those male and female, those who cannot procreate or have infertility problem, and the baby inside the womb, if having any problem or not, how can we identify or how can we treat or how can we prevent the genetic disorders. So basically these things all started from a scratch, and I can show you, this is my the research work at the time of masters, and you can see the date, that is 88-89, and it is prenatal determination of chromosomal anomaly with the help of chorionic villus biopsy. Now the chorionic villus biopsy, it means that this is the early pregnancy and you can take this sample from the chorion, and because chorion is also part of the baby, so you can have an identification of the problem of the baby in earliest part of the pregnancy, that is 2.5 to 3 months. Still we are doing continuously, and this I started in 1988-89. So you can see the things when we have started, and these are the few photographs of the chromosomes we have harvested at that time. Very difficult to do photomicrography at that time because there were no digital cameras, and if you have little bit shaking of the camera, these all pictures will be shaken. So these are the clearest picture with lot of help from lot of quarters, because we don't have any money, coming from a very humble and very not very poor but still very economically not sound background, and doing this, which is established in Italy by Carl Simoni, and we did it successfully in 1988-89. With this I learned how to maintain cell life outside the body. With this, I started doing ultrasound guided procedures from 1991 with a linear ultrasound. Again, there are multiple helps from a lot of quarters. No money to get training for IVF because Louis Brown was born in 1978. I have a very high ambition of doing IVF in my center in Jabalpur, making our own center. No money, nothing, not able to do any training from anywhere. So started this with this help of biotechnology. This is the very old record of my IVF work of 1997. On those days, not very successful, but we have started doing IVF 1997, and one record is from 1996. So these things are started. We make our own media, our own. I taught my wife, Dr. Rinku Banerjee, and initiated with the embryology. So she becomes a very big help gradually, and she perfected in clinical embryology. Then she got later on from Leeds University master's degree, and in those time we started, and we got our first success. I think this is 10th August or 10th August 2020, 2003. So 20 years back, there was the first baby born in our center. And you can see we have already started prenatal diagnosis of thalassemia and sickle cell since the beginning by doing chorion villus sampling. These are few photographs of our previous lab, and this is the photograph of that baby which was born in 2003, me and my wife, Dr. Rinku Banerjee. These are the things which this is the first type of very small, very primitive kind of laminar flow, and previously we had our Indian variety of incubator. Then we purchased this. So gradually this journey goes on, and now we have multiple tri-gas incubator of a very good brand, and very high quality equipment of microscopes and ultrasound. So gradually this journey is grown, and still for the quest of the perfection we are still maintaining in two fields, that is doing in reproductive medicine for male and female infertility so that they can have their own biological child. And second, if the lady conceives, then there should be a healthy baby. For getting a healthy baby, it should be identified as early as possible if there is any problem, so that they can take a decision. For that you need a very good fetal medicine program, that is unborn baby health program. Somebody call it prenatal pediatric program, or it is called fetology program. So we started this thing since 1991, and in 88, 89 we did this disease detection by Korean biopsy through Korean villus sampling. So this is the journey, and gradually it was very difficult to spread the message what we are doing, but because of rapid advancement of internet in 2016, India got very good internet advancement. So we started a YouTube channel. Our few YouTube videos are older than 2016. You can see in a different channel. But from 2016 onwards, or rather in 2018, we were regularly updating the channel what we are doing, and now you can see my channel with a very good, my family, very large number of my well-wishers. And I request you, if you like my videos, if you like my channel, please subscribe it, so that rise in subscription gives a very big confidence that I am getting new friends and you are liking me. Thank you very much for patient listening. This was my journey. It started from scratch because there was nothing, no economic help. It is all innovation, individual innovation. We developed a lot of things and developed our own school of thought. We never followed anybody, but gradually it was day 2 transfer, very difficult to switch on to day 3, day 5, doing a sequential culture, doing blastocyst culture, but we are doing blastocyst culture since 2003. So you can see how it has started, because we learned what don't work, so that if you learn by this method, although the learning curve was very little bit longer, but we learned that how the things cannot work, so we avoid those things so that things can work. It gives a better success rate. If you like this channel, please subscribe. Thank you very much.